Welcome to the beginning tutorial on conducting assessments. This is where we investigate the process of information gathering in a clinical simulation. Now, as you are already likely aware, there are two types of activities in a clinical simulation. As you advance from screen to screen, you're either engaging in the process of gathering information, also called information gathering, or you're making key decisions regarding the care of the patient, also called decision making. It is about the method of information gathering that we wish to review in this tutorial. The central issue and challenge when conducting an assessment in a clinical simulation is that the user must constantly determine how much information to gather before discontinuing the assessment and treating the patient. In some circumstances, very little information gathering should be done due to the severity of the patient's condition, while in other cases there's adequate time to do a more complete and thorough assessment of the patient. Discerning which exams are appropriate and when the exam should be discontinued is a key skill in conducting assessments in a simulation. Each test, exam, or piece of information either comes with a reward of positive points, increasing your score, or comes with a penalty of negative points or points taken away from your total score. Because of the nature of this type of scoring, it is imperative to make your choices correctly, being sure to gather just enough information to make the best clinical decision while avoiding excess investigations and exams that may be harmful, irrelevant, or may require too much time given the emergent condition of the patient. When considering the time each exam consumes, remember these four categories of exams: visual, bedside, basic laboratory, and special testing. Visual data is that data that can be ascertained simply visually or just by glancing at the patient. Color, chest movement, respiratory rate, and rhythm would be examples of these. Bedside data or level 2 data would include breath sounds, bedside basic pulmonary function testing, peak flow measurements, blood pressure, temperature, and so on. These data are also gathered quickly, but require some interaction with the patient. Basic laboratory data, or level 3 examinations, require such issues as blood work or x-rays, ABGs, a chest x-ray, CBC, electrolyte, and others. These exams may be done fairly quickly, but require some level of analysis and often a professional level of interpretation. Finally, the last category is called special testing. This is level 4. This involves complex pulmonary function testing, CT scans, ventilation perfusion scans, and all those kinds of exams that are specific, expensive, and reveal great detail or diagnostic information about the patient. Now, we will go into these four categories of exams in greater detail in subsequent tutorials, but the general idea is to conduct an assessment in 4 stages or levels. After level 1, for instance, after the visual data has been ascertained, the data should be examined by the respiratory practitioner, and the RT should determine if the patient is stable enough to have other exams and to endure more complex testing, such as arterial blood gases and chest x-rays, and so on. Before we investigate and attempt to understand these levels of investigation, let's just take a moment to understand what it is that you might find difficult about selecting items during an assessment in a clinical simulation. One of the most significant challenges has to do with the way one thinks about the selection process during the clinical sim. Clinical simulations are different than any other type of exam, and we're really just not used to them. What we are used to, however, is multiple choice questions. By the time you've reached this point in your life, you have undoubtedly seen thousands upon thousands of multiple choice questions. You've used them since you can remember, and you've used them in every kind of academic class. You've used multiple choice to get your driver's license. You've used multiple choice to pass an exam at school. You've seen a lot of them. The problem with the multiple choice type questions is that they're not like real life. So take, for instance, your life. In your real life, isn't it true that when you have a problem, the possibilities of how to react to that problem are infinite? It doesn't always come down to just 4 choices, does it? So consequently, the thousands of multiple choice questions that we have done have somewhat misled us into thinking that we are problem solvers. But multiple choice questions have a tendency to destroy our ability to critically think. What really happens is that we look at a multiple choice question, we read the question, and then instead of thinking what we would really want to do about it, we just immediately go to the answers and we're open for suggestions. And so then we read those answers and we decide that one of those must be the best answer, and so we pick one. As you can imagine, the critical thinking process that is supposed to occur after you read a question is sometimes forgotten. So to show that what we mean by this, let's take a closer look into your head and kind of examine what's really going on during a multiple choice question. Now here's an example of a typical multiple choice question in respiratory therapy. So it provides some information about a patient, their background, it provides a blood gas. I want to get mechanical with you just for a moment and let you know what happens, help you discover what happens to you when you read a question like this. So after you read the question, your eyes ultimately make it to this question mark here, and then I want you to think about what happens to your eyes next. Where do your eyes go next? Now you may think that's an obvious answer. They go to the answers, of course, right? But in fact, they can't go to all the answers at once, so you actually pick one of the answers to evaluate. Typically, most people, of course, pick A, and they look at that. Turns out about 25% of the population will pick another one, usually D and sometimes C. It doesn't really matter, whatever answer you choose to look at first. Don't you look at that, read it, and then try to make a decision? You try to put a label on that answer, yes, no, or maybe. And of course, if it's yes, you might pick it. You may not even look at the others. You wouldn't want to do that on the NBRC exam because there may be a better answer. Very often there are two answers that are yes, sometimes three answers that will work, and so you'll want to look at all of them. But in this way, you have a tendency to pick one answer, and then if that's a no, you'll go to the next one. You might go to B, C, or D, and hopefully by the end you have one yes and three no's. But of course, all too often, especially on the NBRC exam, you have no yeses and a couple maybes and maybe one no. That's when you just decide to guess at things. Or maybe you have a policy of picking a certain answer when you don't know what the answer is at all. A lot of people feel like they should pick C. But statistically, it doesn't really matter. So this is how we typically function when we look at a question. Now this process works for multiple choice, but you can get in trouble if you use this exact same process when you do it in a clinical simulation. Now before we go on, I just want to mention here that some of you have definitely deeply read this question even though that we didn't read the question, and you've already tried to answer it. And that's because you kind of turn into a machine when you see multiple choice questions. We want to kind of avoid that for a moment when we go into clinical simulations. We have to read and understand, and I want to show you what process to avoid in a clinical simulation that you typically do use in a multiple choice question. Okay, so let's take a look at a clinical simulation setting. And here's an example of one, and as you glance at it, it looks somewhat like a multiple choice question, only without the labels of A, B, C, D. And of course there's more options than just 4, but otherwise the top scenario looks like the question. And what's different here in this case is that we're doing an assessment that we can select as many as we feel indicated. But again, it just feels like we're supposed to go down the list. Here's A, B, C, D, and just pick the ones that we think are yes and leave the ones that we think are no alone. So let's take this situation, though, to facilitate what we're talking about. Let's actually read this question or read this scenario and decide what we're supposed to do. Now this one says you are a respiratory therapist working the night shift in a 300-bed hospital. You're paged to the 3rd floor to follow up on a patient who the nurse reports as having ventilatory difficulty. And the doctor has requested you to perform a thorough assessment of the patient, and you will now include which of the following in your assessment. And then it says we can select many if we choose. Now before we attempt to look at these options here in these exams and decide which ones are appropriate, my first question to you is, as you read that, we're asked to do a thorough assessment. Now what is a thorough assessment? I hope you're thinking that means everything, it's complete, it goes in depth, and so we're not just picking light stuff or simple things or visual things. It does say that we need to do a thorough assessment. Now that might be a misleading. We'll talk about how that plays into it later, but let's take a look at the options now, and we'll just start off kind of like multiple choice at the top one, and we'll look at A, vital capacity, and we'll decide whether we want that. Now this may be tough for you, but if I were to ask you, do you want to do that? You may say yes or no, but let's say we decided to. And really, in a thorough assessment on the NBRC, that would be a good exam to take. I know that in real life we're not running around checking people's vital capacities, but in fact, if you did, wouldn't it show critical ventilation data? If you had somebody with a drug overdose, wouldn't their vital capacity be low, or myasthenia gravis, or some other ventilatory issues? So it is valid data, and let's say we pick it, and it says patient is unable. And we don't know if that's right or wrong, do we? It just says the patient's unable. In fact, that may not be numerical data, but it is data, the fact that the patient can't do it. So we'll just take that as it is, and then we'll go to the next one. That is arterial blood gases. Well, that sounds good. I mean, isn't that the exam that tells us the most about the patient? I mean, that's our key exam. So it tells us about ventilation and oxygenation. So let's pick that one. And when we do, we get the answer not done. Does that mean it's right or wrong? It's hard to tell, but it does make us feel uneasy. We were hoping for some information there. It might even make us feel like it's wrong, but you can't really tell at this point. And the next one is a chest radiograph. Okay, this is just an x-ray, and when we click it, that sounds good, but it says ordered. Again, that's unnerving, but it doesn't mean that it's wrong. Now the next option is a Coombs test, and if I were to ask you, do you want to get a Coombs test? Probably most of you are saying, I don't even know what a Coombs test is, right? And so have you ever heard the rule, if you don't know what it is, don't pick it? That one would apply here. For some reason, we see Coombs test on the exam from time to time and never really see it as a correct answer. I won't tell you what it is because I think it's important that as you see tests and exams on the actual clinical simulation that you don't know what they are, then that's your key and your signal to just kind of put it on the back burner and ignore it. Then there's the LS ratio. Do you want that? Well, what is that? Well, that's a special test that is used to determine the fetal lung maturity. And so it involves the amniotic fluid. Also, there's something called a shake test. It looks for bubbles. It's something similar to that. Well, this is a grown person and doesn't even mention that the patient's pregnant. So that's probably not going to be appropriate here. And then finally we have heart rate, and that seems like an obvious one, so we'll go ahead and get that. And it's 10 beats per minute. Uh-oh. So what we should be thinking is, what does the patient need right now? And that is, the patient needs CPR. Now here's the question. If the first thing you knew about the patient when you walked into the room was that their heart rate was 10 beats per minute, would you be thinking, I better get an ABG, or I better call chest x-ray? Of course you wouldn't. If you did that, the patient would have a high tendency to die on you before you found that ABG kit, or especially before x-ray came. And so what you see here, and this is the point, not only do you have to pick the right answers, but you need to pick them in the right order. And so what we have to avoid, when we do multiple choice, we start at the top often and we just say yes, no, yes, no. Well, if we did that here, we would go to vital capacity. We'd say yes, because that's a good part of a thorough assessment. And an ABG, yes, because that tells us about ventilation and oxygenation, etc. But an ABG would be a good part of a thorough assessment, but it became wrong as soon as we found out that the heart rate was 10 beats per minute. And so you must pick things that are correct, but you must also pick them in the right order. In other words, you must assess the patient in degrees. Look at the information as you gather it, and make decisions on the fly as to whether you want to continue the assessment and gather more information, or to discontinue the assessment and proceed to the next menu in hopes of treating the patient. So knowing the order to pick the data is very important. It's part of a process that we'll cover in the next section, Conducting Assessment Tutorials.